For many women, it's not unusual to experience bloating, urinary urgency, or even pelvic pain, especially with hormonal changes. So how do we know when these bothersome symptoms are a sign of something more serious, like ovarian cancer? We're here with Dr. Catherine Kennedy, CARTI's new gynecologic oncologist, to answer some of those questions. Thank you for joining us today.
Of course.
So I know that September is Ovarian Cancer Awareness Month, and so this is when we're kind of having this focus on ovarian cancer. So first of all, walk us through, what are some of the most common symptoms of ovarian cancer that people need to be aware of?
Absolutely. So like you said, unfortunately, a lot of the symptoms can be somewhat vague. So bloating is really one of the most common symptoms, and that can be associated with just a generalized abdominal pain or crampiness. That often is associated with changes in bowel habits, changes in urinary habits such as frequency or urgency, even urinary incontinence. Some women may have some vaginal discharge or spotting, but not always. Usually it's just a generalized fatigue, unintended weight changes, or really feeling off over a long period of time, at which point there may be a sign that something else is going on.
Yeah, and I know just some of the symptoms that you mentioned, I'm thinking about for most women at different points in their lives, those are things that kind of we just experience anyway.
Absolutely.
So when does that change into, okay, I need to go get this checked out?
So I always tell patients, if it is persistent and worsening in severity, that's when you really need to speak with your doctor. Generally, I tell people, if you have one of those symptoms for more than a few weeks and it's not going away and it's not alleviated by, over-the-counter meds or just rest, that's when you should go in and get checked out.
And are there certain women that have a greater risk of contracting ovarian cancer?
Absolutely. Unfortunately, our greatest risk as women for ovarian cancer is just the aging process, which obviously, unfortunately, we can't do too much about. But there are certain familial patterns or genetic conditions that also make women at greater risk. Some things that are a little bit different between women might be things like weight. Overweight women are at higher risk. Hormone replacement therapy around the time of menopause. Women who have never been pregnant or women who have early periods or late menopause are also some additional risk factors.
And I know for, all cancers, we wish that there was just a vaccine you could get and then that would be it. Unfortunately, that's not the case, but are there certain habits or ways that we can take care of ourselves to help prevent getting this?
Absolutely. So just in general, maintaining a healthy weight and a healthy lifestyle through diet, exercise, all those usual good things is always a safe bet. Even birth control pills actually reduce the risk of ovarian cancer.
Okay.
And if you have a specific genetic condition, things you may have heard of like BRCA1 and 2 or other similar conditions, those are things you could talk to your doctor about to do a risk-reducing surgery where you remove the ovaries and fallopian tubes to minimize that risk.
Perfect. So a lot of information, but thank you so much for sharing all of that. And remember, it's just about being aware of your body and going and getting help when you realize that something is different.
Exactly.
And of course, head to CARTI for more information. They do a fantastic job. Thank you for coming in.
Thank you. Thank you so much for having me.
Of course.